Geoff, who has been a member of the Strelka project for some time, is a Los Angeles-based writer and author of the New York Times bestselling book Burglar's Guide to the City. He's taught in multiple design programs around the world. He is editor of the what I still think is the best architecture and urbanism blog, Building blog, with Nicola, who is with Nicola, who is the co-host of the Gastropod podcast, are also a frequent contributor to the New York Times. They're currently co-authoring a book about the past, present, and future of quarantine for Strauss and Giroux, which is only one of the reasons we've asked them to participate with us today. The talk they've prepared is called Architectures of Anticipation. And with that, that entry into the questions of quarantine urbanism, I happily pass the mic to Geoff and Nicola.
Great. Yeah, thanks, Benjamin, for hosting us, and to everybody at Strelka for putting this together. Thanks as well to all the people in the audience. It's really great to see faces, even on Zoom. So thanks for tuning in. We thought that what we would do in the limited time that we have available is just kind of give an overview and an introduction to the book and talk a little bit about what it was that brought us to the topic of quarantine, how quarantine is interesting from an urban point of view, and end on some thoughts about spatial politics and the ethics of quarantine and that kind of thing. So just to start off, I'd say that we really have been working on we've been working on the book specifically for about 3 or 4 years, but we've been researching quarantine for about a decade. This really kicked off actually about 10 years ago when we were in Australia for a teaching gig in Sydney. And one of the things that we noticed actually was that this old sprawling luxury hotel on the opposite side of the bay had at one point been a quarantine station. And so the question at the time really became, what was quarantine? What was this thing that we used to practice that was a kind of medical protocol for keeping people separated from one another? And where did quarantine go? Why is it that when you look into quarantine, you see that for the most part, they are ruins outside the city somewhere. It's a ruined structure on an island. It's a ruined structure out in the marshes somewhere, or it's been converted into something and given a totally new use. So quarantine, in a way, felt like this kind of obsolete spatial practice that didn't really have a place in the modern world, and we wanted to track that. As you can imagine, as soon as you begin looking into this, not only is it obvious that quarantine didn't go anywhere, but in the era of the coronavirus, it's very clear that, like the revenge of the real, we're kind of living through the revenge of quarantine. But so in any case, quarantine is not just interesting from an architectural and spatial point of view, although we will be talking about that today. It's also obviously very interesting from a conceptual and metaphoric point of view. One of the things that I think is so fascinating about quarantine and that really drew us to the topic is that quarantine requires uncertainty. It's often confused in the media with the concept of isolation. So quarantine and isolation look similar, but they're not the same thing. So if you know you have a disease, then you can be isolated. If you know that someone is infected, then that's a totally different conceptual category. Quarantine requires you not to know if you have this thing. You don't know if this virus, this infection is inside of you, and you don't know if it's inside of others. And so quarantine becomes the kind of spatial choreography for managing that uncertainty and playing with this idea that something might be emerging from you, and you're not yet sure if it's within. So because of that, then, the architecture of quarantine becomes this an architecture of anticipation, anticipating an emergence, and an architecture of uncertainty. And a whole cascade of other interesting metaphors results from that. There's the idea of what does it mean to experience exposure when you come in contact with the other, that Jean-Luc was talking about earlier, of the metaphor of immunity. What does it mean to be immune to the other, to be able to resist its touch? Of contamination, what does it mean to be overrun with the other, to be so thoroughly permeated by the other that one is contaminated? And then, of course, contagion as well as a metaphor, where the other is out of control and cannot be contained when the other has exceeded all bounds. So quarantine then becomes both the idea of a spatial gap, where you introduce a buffer. So here is this thing that could be contaminated, and then here is this thing that is not, or we think that is not. And so we introduce a gap or a separation. That's the spatial buffer of quarantine. But quarantine is also temporal. The entire point of quarantine is that it has a limited amount of time, and that at the other side of that moment of time, or that period, something is considered safe. And so it's also the introduction of a kind of managed delay, of a period of waiting, of a kind of regulated pause. And in that, yet another metaphor comes in, which is this idea of arrival. One thing I think is interesting is that with quarantine, you can ask the question of, when does something actually arrive? When does the disease arrive in our city? When has the disease arrived inside us? What does arrival mean, and where does arrival even occur? So in any case, all of these metaphors and all of these concepts kind of get thrown in to any discussion of quarantine. And yet at the same time, I do want to tie things back to the specific mechanisms by which quarantine is built into the world. So quarantine, we might argue, is the most architectural of state powers. It's the ability of the state to spatially regulate our encounters with one another. And it's also at heart, a very architectural undertaking in the first place. Quarantine is very much about where the walls and doors might be. It's about where openings and windows will be. And it's also specifically about circulation and sequence. It's about two people being able to be in the same room without being in the same space, or multiple people being in the same building without ever encountering one another. So it's very much at its heart, this very specific control of architectural space and this control of architectural time. And I'll throw that over to you.
Yeah, so as Geoff mentioned, for this book, we actually traveled around sort of retracing the ruins of quarantine, this past that can now inform our present. And so going back to the beginning, the practice of quarantine was formalized in the Mediterranean, specifically the Adriatic during the Black Death, as a means to protect human health while maintaining the lucrative trade on which the region's wealth was based. And that's a theme that you see again and again with discussions of quarantine. You know, an outbreak has a way of sort of illuminating those stark risk-benefit analyses that set health against wealth, as we saw in the earlier presentation. So the first lazaretto, or quarantine facility, or spatial buffer, as Geoff called it, was built in Dubrovnik. And the initial temporal pause, that piece of the equation, was just 30 days. That was then extended to 40 days, from whence we get quarantine, or quaranta giorni. But the practice is most closely associated with Venice, and that's really where it was perfected, on islands in the lagoon, first the Lazaretto Vecchio and then the Lazaretto Nuovo, which added facilities for disinfecting cargo. Both of those largely lie in ruins today. We were able to visit both. Venice is, of course, thanks to its topography and its geography, the perfect laboratory for these kinds of urban experiments in spatializing control and limiting exposure. Witness perhaps its best known innovation, the ghetto. So tracing that idea forward, we then visited the first federal quarantine center built in more than 100 years, which is in Omaha, Nebraska, almost the dead center of the United States. And what's the trajectory there is a fascinating one, thanks to advances in technology and engineering. You know, the periphery has become the center. The border can be offshored. The border can be everywhere. The border can be crystallized into these practices and structures that reveal where inside and outside meet. And so as we trace that sort of trajectory of how this spatial buffer and temporal pause gets crystallized into processes and structures, you can see how the specific placement of the border kind of shifts thanks to those kinds of advances.
And one of the things that I think is very interesting about quarantine, and that I'll talk about briefly, is that things that are instituted during quarantine tend to become permanent. And so that's both a risk and something to watch out for. A good example of that, stemming from what Nikki was just talking about, is actually that often where quarantine inspection stations were placed historically, hardened over time to actually become modern day geopolitical sites of interest, including the border between Egypt and Sudan, which actually follows along of an old quarantine inspection line, which has now been hardened into a geopolitical border that is at one point used to be entirely for the purposes of quarantine. But so in any case, one thing that I think obviously that we're starting to see in the era of coronavirus is that the one of the ways out of quarantine is by implementing new forms of contact tracing and a new kind of almost like informatic urbanism, where we can trace everything, track where exposure may or may not be occurring, and follow along where people might be in a new kind of epidemiological geography that we can tap into with smartphones and apps and that kind of thing. So what we see then are everything from getting a warning if you're approaching a supposedly infected neighborhood on your smartphone. We've seen examples of obviously tripping off red flags if you leave an apartment when you're not supposed to be because you're wearing a wristband, or because your phone suddenly now registers in a place where it isn't supposed to be, or because facial recognition software picks you up in a part of the city that you're not meant to be in. There was even a really interesting program that was being trialed in India, where in order to prove that you were in quarantine, you had to take a geo-tagged selfie every few hours as a way both to use the face as a kind of proof of who you say you are, but also as a way to prove that you're located where you say you are and that you haven't violated quarantine. But so these kinds of things show that there's a kind of algorithmic approach to quarantine emerging, where the sort of the titans of big data, Google, Facebook, Apple, are coming together to find ways of tracking the populace so as to ensure that if we do come into contact with one another, if we do cross the interface, so to speak, that we can manage that and track it and understand who might therefore be infected. But what's also somewhat ominous is that national intelligence agencies are kind of coming out of the woodwork and revealing that they not only already had tools that could do these sorts of things, but also are stepping into a kind of goldmine of being able to tap into biometric data and healthcare and infrastructural data in order to track the populace. It's a kind of emerging overlap between the nation-state espionage and the healthcare industry. What's interesting as well is that Benjamin and Jean-Luc earlier were talking about the ethics and the politics of touch. One of the ways that also that the city is changing is that we're moving into a kind of touchless urbanism, a kind of contactless world. We see that in ways that the face itself obviously is becoming the interface so that we can engage in transactions or get onto the subway. But we no longer touch doors or touch faucets in public bathrooms. You can get onto the subway without using a coin or a card. We're entering a world where we don't ever need to touch anything or contact anything. And it's to the point that the metaphor of contact tracing, I think, is quite interesting, because it suggests that the very concept of contact now is so risky and so dangerous that it requires the unveiling of a massive planetary scaled tracking system to ensure that we do not come into contact with one another. And so obviously then going back to what we've been talking about in a couple examples here, if quarantine leaves fossils and ruins around the world, whether it's a luxury hotel in Australia, or it's a ruin on an island in Venice, or it's a national border between Egypt and Sudan, what are going to be the ruins of the coronavirus? What will we be living through in 20 years or even 100 years? What are the things being laid down now, such as ubiquitous contact tracing or other forms of spatiality that will become permanent and that we will no longer think of as fossils of the coronavirus, but are in fact laid down in the traces of COVID?
And then picking up on that theme of the politics of quarantine, I think one of the things that is important to remember about quarantine is because, unlike isolation or, for example, the certainty of health as demonstrated by, say, a health passport, and it's interesting there to note that those health passports were actually the foundation of modern travel documents. But quarantine is at heart a state of uncertainty. If you are certain about your status, diseased or healthy, then you cannot be in quarantine. And that uncertainty is obviously sort of deeply tied into suspicion. So there's a long history of bias implicit in the application of quarantine. Who is the most suspicious? Obviously, the people that you have an innate bias against. So throughout its history, quarantine powers have been used to detain poor non-white immigrants. They've also been used to contain poor but economically active women who were suspected of carrying venereal disease under the ominously named American Plan. This sort of liminal status of quarantine, where you're diseased until proven healthy or essentially guilty until proven innocent, has made it a source of sort of endless fascination to legal theorists. And one of the most interesting examples we've come across in our research is in Guantanamo Bay. Before it became better known for waterboarding and Camp X-ray, in the early 90s, Camp Bulkley in Guantanamo Bay became a temporary home for Haitian refugees suspected of being HIV positive. It was a quarantine zone outside the borders of the nation state. And it's not hard to see how that liminal status, the sort of constitutional exceptionalism of quarantine, set a kind of precedent then for the detention of individuals as unlawful enemy combatants later, outside the protection of the Geneva Convention, etc. In an even more ominous sort of inversion, there was then legal scholars in the Bush administration in the early 2000s drew on the example of enemy combatants to rewrite the rights of the quarantined. So these two, this sort of very curious liminality of quarantine as it stands in relation to the normal rights of civil rights has made it sort of both a tool and something that legal scholars have found fascinating to think about the edges of state power and how that and individual rights and how those are applied. One interesting thing to go back to, I saw a question in chat about carceral architectures, etc. And in fact, our tour of the sort of quarantine archaeology of the Mediterranean Adriatic is largely based on a similar tour that was taken by John Howard, one of the earliest prison reformers. He had been studying the conditions in the prisons of Europe and writing about them and campaigning about them, and then came across lazarettos, a sort of similar situation of detention for different purposes, and decided to document those. So there is that overlap.
Mm. So yeah, there's obviously much more to say about quarantine. We also track quarantine in the book across species and in massive timescales. We look at planetary quarantine and so on. But I think that what we'll do for a time is just cut things off there and say if there are questions we can address now, or move on to whatever you want to do.
Yeah, Geoff, thank you very much. What we're going to do to consolidate a little bit is we're going to have the next two projects, one on quarantine urbanism, one on resilient automation. We're going to have those present quickly, and then we'll do a kind of consolidated Q&A after that, if that's all right with you all. I wonder if you could let us know when the book is coming out, when we'll be able to have access to the research.
It's coming out in the spring of 2021. So this time next year, we can all come back on Zoom and speak to each other in the endless quarantine. Yeah. Indeed,
we'll do a virtual. Thank you very much for this. Is obviously incredibly timely, and we're thank you for giving us a sneak preview of what I'm sure will be the really important book.